Good morning, everyone. Thank you for joining us in person and across Zoom. This is my regular update on the status of where New York State is with respect to dealing with this pandemic as well as our recovery. And the issue I'll be happy to start off with is our new mask mandate. We announced on Friday, after consultation with many individuals, including a call to the head of the Association of Counties that I placed myself, who said they support what we're doing and they understand it, as well as my calls to individual county executives, as well as a call that my staff did, as well as calls to the Business Council, State of New York, the Partnership for New York, as well as the Council of Mayors, and many, many calls were put out on Thursday to give the heads up of what we were thinking of doing at the time in light of the numbers that we saw continue to escalate upward. And so therefore on Friday, after consultation with many individuals, including our Department of Health, Dr. Mary Bassett, we determined that my priorities will continue to be furthered by having a statewide mask requirement. And the objective is, as I've said all along, it is twofold. Protect the health of New Yorkers and protect the health of our economy. And this is a short-term measure. It has a time frame associated with it. And if you want to contrast what we dealt with in the past, it was open-ended. There was a lot of uncertainty. And I believe that given that we're in a very different place now, that we have the ability to let people know that this has a deadline on it. I'm going to be assessing our numbers and hopefully progress that has been made by January 15th. And the whole purpose of this, protect individuals' lives, particularly during what we're experiencing right now, which is a holiday surge. And I'll show you some numbers in a couple of moments that'll confirm in everyone's minds that we are experiencing a surge. So we now have, this is something that other states have done, a number of states, I think 7 now have done this. And let me walk through the metrics for anybody who may be confused as to why we did this. We've been talking about this. This is not a surprise. We talked about this in the fall. I said I'm worried about Halloween. Thanksgiving, of course, is a huge point of vulnerability. We get through Hanukkah. Now we have Christmas, Kwanzaa, other holiday gatherings. And certainly New Year's Eve is something that is an area of a day of celebration together, but it's also a concern of ours. So let's look at the cases, number one. Our statewide, New York State average has gone up 58% since Thanksgiving. When I spoke to you last week, it had gone up 43%. That was the trigger I used to say that that is enough. Look at where we are today, 43% to 58%. And what we look at, not the individual percentages, because that's reliant more on how many people are getting tested in an area, which we don't have control on. People do home testing now. They do testing at their workplace, so we don't have a clear picture always of getting those results in real time. So we look at the cases per 100,000, and those numbers are up 58%. You can see the various regions that have been hit so hard. Southern Tier, 85. It looks like the highest there. Mohawk Valley, 74. So these are not trending in the right direction. And you can see the cases by county. We've broken out, and you can see on a map where they mostly are. And I will take note that places like Erie County had been worse. It's trending a little bit better. They've had a mask mandate in place for a number of weeks. Again, I thank County Executive Mark Polenkar. I thank the other county leaders who've stepped up to do this on their own. And they are certainly appreciative now that the state will give them, as I mentioned, air cover in a sense, to make sure that we know that this is a statewide policy based on what is a statewide phenomenon. My original objective was to do this in a surgical way, county by county, and when we see cases going up statewide, that's what called into the necessity of seeing a statewide situation here. Also, cases going up, hospitalizations are going up. Hospitalizations are up 70% since Thanksgiving. When I announced this on Friday, they had gone up 29%. To me, that was the trigger I needed. Look what's happened. Just in that short time, we've warned this. We anticipated a spike after Thanksgiving, and it has arrived. And so this is an alarming jump statewide. Also, the vaccinations. This has always been our ticket out. If people got vaccinated, got boosted, did the right thing, we would not be having these conversations. In fact, if 100% of New Yorkers had done this, I'm not even sure I'd be having to give COVID updates because this would be in the rearview mirror. And you think about how far we've come. Literally 1 year ago today, we had Sandra Lindsay become the first person in our state. The first one in the U.S. was done right here in New York State. This is a significant anniversary. And to all of us who are watching this so closely, this was a turning point in our war against COVID, because back in March of 2020, in the depths of this dark, dark experience, we are told that normally it takes anywhere from 2 to 4 years for the pharmaceuticals to develop a vaccination that would work, that the protocols, the requirements to get through were years down the road. And when this happened, literally 9 months after the first case in New York, it was an extraordinary accomplishment. Everyone was so excited. We said, yes, this is how we're going to get through this pandemic. We have a vaccine that works. Remember that moment. It was the turning point. And today I should be able to say that it's over because everyone took advantage of this opportunity created by science and the smartest people on this planet who gathered to help save lives. And I have such respect for them, and they don't get the credit they deserve for the speed at which they brought this to market and how effective it has been. But even though we've had 31 million shots in arms here in the state of New York, we still have 30% of New Yorkers who are not fully vaccinated. 30%. This is a crisis of the unvaccinated. Did not have to be totally preventable. So if I sound a little frustrated, perhaps I am. This did not have to be the case 1 year after this life-saving vaccine arrived on the scene right here in New York State. It has been available based on age, based on health, based on occupation early on, and then it became widely available to everyone. So the other thing I was looking at, cases, hospitalizations. I told you I'm watching the vaccinations. If we had 100% vaccinated, wouldn't be here. We only had a 2% increase in New Yorkers fully vaccinated since Thanksgiving. 2% increase. Now, compared to other states, these are not bad numbers. And to those who got vaccinated, I thank you. But 2% increase since we started talking about how vulnerable we all were to this indoor holiday surge, particularly northeastern states. This is not just New York. This has been a northeastern state phenomenon because of the cold, people heading indoors, and you realize a lot of people have left the northeastern states, so they come back from their other states to join family during the holidays, perhaps bringing the virus as well. So there's a lot of factors at play here. So thank you to the 82% of New Yorkers that we have, but when you look at the whole scale, that's 18 plus, we still have to get to our children. The number of children who've now had the ability to get vaccinated is not where it should be. And I've asked school districts and schools to have in-school pop-up sites. We'll make sure all the resources they need are available, and we just have to stimulate more interest in protecting these kids. Not that I'm saying there's a huge number of children hospitalized, but they are the spreaders to their vulnerable grandparents, aunts and uncles, and others in the community. So those are the three metrics I looked at. None of them were satisfying to me. In combination, it spells a very challenging situation for us. And I know this has not been easy on businesses. I've told many times the story of how I helped my mom start a small flower shop. I know the struggle as you sit there and wait and wait and wait for that little bell to ring that means someone walked into your door. I was there. I know how hard it is, and I have had constant communication with people in the restaurant industry. We're still down 120,000 jobs right here in New York City from the restaurant and hospitality industry already. We've had an impact in every corner of the state, the restaurants, the gathering places, the convention centers, venues, we have had a huge impact. And so I want to thank the business owners who understood that despite our desires to have this be behind us, that we're not quite there yet. And they also know that this is not an overreaction. It took us a while to get to a point where I could actually point to numbers and say, my friends, we're not trending in the right direction. We have to take what, in contrast to the steps that had to be taken in the past, is truly a minor infringement. Your children are already wearing masks. They're very adaptable. They're fine. At some point, we'll be able to announce that time is over. We're not there yet. And the people who last year were told that you couldn't gather with family in your own home with groups larger than 10, and you could not go out to restaurants, and you could not have that wedding, you could not go to that funeral. We've come so far since then. But we also know the cataclysmic effect that all of this had on the psyche of Americans and New Yorkers. And I know it's been tough. We've seen hard numbers in terms of children who were isolated, did not get a quality education during that time frame. Literally almost 2 years of a genuine education lost. Black and brown communities already hit the hardest by this pandemic. Their children most vulnerable. They're the ones falling hardest behind, and it's something we have to address, and we are addressing. But businesses, my desire, my objective with this mask or vax mandate has been to keep you open, to keep your doors open so you can continue to resume what you do every single day. You're a critical part of our state's economy. You're an important part of our communities. You're a place that people have their jobs. And so this mask mandate simply gives you the option, if you are already a facility that has a vaccination requirement, fully vaccinated, you're enforcing it. No one even has to wear a mask in your establishment. If you do not want to have a vaccine requirement, then simply ask people to wear a mask, and you can stay open. That's what this is about, keeping you open, not having the devastating effect on our economy that we experienced over the past 20-some months. So we are trying to be as helpful as we can to the business owners. We put out frequently asked questions on our website. We're giving people signs that they can put in their businesses. And also at this point, I do want to thank some individual business owners. And I've mentioned the elected leaders who've stepped up. I also want to recognize some business leaders and elected officials who have stepped up. And let me introduce some interesting friends here we have. I thank you from the bottom of my heart for hanging in there with us and doing the right thing to protect not just your patrons, but also your employees. So first of all, I'd like to introduce Mayor Billy Barlow, Mayor of the city of Oswego, incredible leader. I want to have him give a few reflections, and then I'll introduce our other participants. Mayor Barlow.
Well, thank you for having me, Governor. I'm happy to participate in sharing today's message, and I'd like to thank you, Governor, for your leadership on COVID-19 and a whole host of other issues since taking office. I do think the mask mandate does strike a fair balance, as you've described, between protecting our citizens and allowing businesses to safely stay open and operate successfully. Here in central New York and in Oswego County, city of Oswego, we're in a bit of a severe situation that we have not been in since the pandemic started. We have regional hospitals in Syracuse becoming at capacity. We even now have community hospitals reaching capacity levels. And that was really the primary fight from the get-go against COVID, is to not overwhelm the local healthcare system. And unfortunately, that is what is happening here in central New York. So your mask mandate and message today is entirely appropriate at this time, and will certainly help us slow the spread here in Oswego County. Also, as you mentioned, Governor, the holidays are coming up. That is a major concern in the holiday surge that we see post-holidays, and the new strain is also a major concern. So all of these things make today's situation entirely unique, and something that here in central New York we have yet to experience throughout the pandemic thus far. So again, I think your messaging and actions on masks and COVID to date are certainly appropriate and will help slow the spread. And Governor, I look forward to having you back here in the city of Oswego when times and conditions allow. It's great to see you, and thank you for your help and advocacy.
Thank you, Mayor Barlow, and to all my friends, my favorite bookstores and all the locations we frequent when I visit. I'll be back and tell them to hang in there. Thank you very much. Now we'd like to hear from Tracy Vickery Rosenquist, who's the owner of Chapter 1 Coffee and Tea. I believe you're up in Plattsburgh. How are things in Plattsburgh?
We're doing great up here. We back in the end of August when the spread really hit our county hard, and it was a time that we decided just as a staff, myself and my employees, to go mask again and to have our customers mask again. So things, our customers have been really respectful about it. It's difficult when people forget their masks, but we've been supplying them. And it's important as a mom, it's as important as a business owner for my employees to be safe and protected, and for my customers as well.
Tracy, thank you. I look forward to having a good cup of tea when I come visit up in Plattsburgh again. And really, we know you're on the front lines, and your courage in stepping forward even months ago really helps normalize the situation. People understand it's an expectation to go into your business, and they know that when they want to go out and have coffee or tea and they be safe, they will come to Chapter 1. So thank you for all you do for us, Tracy. Danny Deutsch is also with us today, the owner of Albaline Bar and Lounge, and that is in Rochester. Danny, how are things going in Rochester?
Things are going well, Governor. Thank you. We are a small live music venue. We hold less than 100 people, and we do music every night that we're open. We went to a policy that required proof of vaccination in May of this year. We felt it was the right thing to do for our staff, for our customers, certainly, and for all the musicians, both local and national, who play here. And the response has been very, very good. We still get some people that ask, even after showing their proof of vaccination, if they have to wear a mask. They can if they'd like to, but they are aware that everyone in the building has been vaccinated. And we're going to keep that going, and we think it's the right thing to do. And we certainly hope that more people get vaccinated.
Danny, thank you. Thank you for continuing to create an environment where people can gather safely and enjoy music, and look forward to seeing you on a return trip to Rochester. So thank you, Danny. Last, we'll hear from Jason Seidel, Director of Operations at Cultivar Restaurant, which is in Ithaca, and I've stopped there before as well. Jason?
Thank you, Governor. Yep, thank you, Governor. Really appreciate you having us on today. And more than anything, I just really want to thank you for taking the bold action, requiring everyone to be vaccinated or to wear a mask to come into indoor public spaces, such as restaurants. Being the Director of Operations for the Cultivar Culinary Center, which is owned by the TC3 Foundation, I really care about my employees. I care about my customers. We care about our community. We are embedded in our community, and we want to do everything we can to help make sure everybody stays safe. And if that's wearing masks, requiring people to get vaccinations in order to come out to wonderful restaurants and wonderful places in the community in order to participate and keep the economy going and keep businesses open, then I think that's what we should do. And again, I just thank the governor, and I thank your office for supporting all of us and helping protect all of us.
Thank you, Jason. Hang in there, my friends. And I want to thank all of you for really doing what's right. I know your customers appreciate it. I appreciate it. And certainly as the mayor, thank you for your leadership. And we will be talking to you very soon. So thank you. Thank you, everyone. And
Thank you, Governor.
With respect to leaders like Mayor Billy Barlow, we've done a quick survey, it's not scientific, of the individuals from various counties who stood up in support of our position on the mandate. And if you want to do a quick analysis, I believe they represent 73% of New Yorkers. So thank you to all those leaders in counties throughout our state for what you've done to support this, and those who've done it on your own or those who are able to do it now. I thank you for your leadership, and I will say, to the extent that there's criticism, and there certainly is, I wake up every single day and read the In the Arena speech by one of my favorite presidents, Theodore Roosevelt, and hopefully that'll give you some inspiration that you are in the arena. Sometimes you get bloodied and marred, but it's not the critics who count. It's those who are in the arena doing the right thing. And so I thank all these leaders for what they're doing to keep people safe and to save lives. I also want to thank some of our healthcare institutions who've answered the call for help. Northwell, Northwell Health, you've done an extraordinary job helping us deploy more resources to our hard-hit areas, going up to ECMC in Buffalo and the University of Rochester Strong Memorial. You sent in a number of clinical teams, 16 to be exact, with some lead teams, as well as a two-week mission. So I know there's a lot of excitement and energy when Northwell's teams arrived. The cavalry has arrived, and we thank them for this all one-state approach to battling this pandemic. And he mentioned about the hospitals. Again, you know, I stay up late at night thinking about hospital capacity and how we can continue to increase capacity and make sure people get all the necessary health care they need. So just to recap, we did sign an executive order that expanded our healthcare workforce. We have EMTs, we have National Guard, and National Guard are going to be trained. Those who are not trained will be now trained in case this ever happens again. Allowing to have more healthcare workers administered. We had 120 members of the National Guard deployed to nursing homes. I mentioned this before. They've been embraced. Everybody's happy to see them. They feel safer, we're told, when they see the National Guard on site. And also just making sure that we pause some non-essential elective procedures, but making sure that important treatments, particularly related to cancer and others, are not disrupted. I want to make sure that that was very clear. And so our office, Department of Health, is going to continue working with all the healthcare systems to bring them back, and that's really important. Here's some of the, get this out to everybody so they know that they're still covered. All these elective surgeries can continue. We'll reassess this. Again, giving dates, telegraph that this is not a permanent situation. We're working very closely every day with people who are affected and letting them know that we are optimistic and hopeful that more people will get vaccinated now, and that only increase of 2% from Thanksgiving till now will change, and that it starts going up quickly, and then we can make some dramatic changes protecting the health of New Yorkers. And we talked a lot about the bed capacity overall. The measures are working. They're starting to take hold, which is great news. Non-ICU bed availability is up over 10% across the regions. ICU bed availability is also increasing. Overall beds, and I watched this, we're up 1%, but that's to stem the downward trajectory, which was concerning, very concerning that we were heading downhill quickly, and we certainly were. But we're working around the clock to bring more relief to hospitals and to free up more beds. So trending a little bit better direction because of the steps we've taken. Not where we want to be, but again, at least not heading downward anymore. So what we're doing is focusing on the vaccines, not a news flash. You're not going to make a headline, I'm sure, but this is going to continue to be our paramount priority through the holidays. We have holiday-themed vac sites. We're going to find people where they are. We're going to go outside places of worship after services. We're going to malls where people are shopping centers, larger town holiday events. We're trying to make it easier for people to have that access where they just walk by somebody and say, yeah, why not? Why don't I just get this done? And while the kids are there, they can as well. So we've scheduled these all over the state, and we continue to ramp them up. And we talk about the booster shots. We're starting to see that, again, not determined by our federal entities, the CDC, but booster shots are looking very effective against Omicron. And we have about 38 cases in the state of New York right now, and if that changes during this event, I'll let you know. But we're still learning about this variant, and I want to be crystal clear that the reasons we institute our mask mandate, this is more of a side issue. You saw the 3 metrics that I was focused on, but this is just an issue that we're watching closely. It seems to be spreading more in the northwest part of our country. My first question is it putting people in hospitals? Or are they self-resolving at home? And this is something that's still be determined, but we're watching what's happening around the world and in other parts of our country. So we're still learning a great deal about this. Boosters starting to tick up. We have 50% of the 65 and up population. The most vulnerable population is our seniors. Number one, think about this. We had the first dose in New York 1 year ago. Senior citizens were the ones who got the early doses. They got them in nursing homes and in senior centers last December, January, February. And to the extent that they have a lifespan, and all this is to be determined, and I'm not saying anything official here, but to the extent that they are effective for a certain period of time, the seniors are the ones who are more likely to have it wearing down, the efficacy of it. So that's why they need to get boosted. And we also have had 70% of people in nursing homes, long-term facilities, have had their booster shot. And this is because we've had intense coordination with our nursing homes over the past few months. And to date, we've had over 5,000 vaccination events in 1,100 long-term care facilities. Again, a year ago and today, our most vulnerable remain our senior citizens. So you can see the number of doses that have gone up. I think it could be higher. I'm challenging New Yorkers. No excuses. You'll feel a lot better this holiday season. Thank you for getting the vaccine in the first place. The booster is what you need for that extra layer of armor against this pandemic. Again, I mentioned Omicron real quickly here. We have 38 cases. The most are New York City, 23 there, and one scattering between Westchester, 4 in Suffolk, 1 in Broome, 3 in Nassau, Oneida, and Onondaga 1 as well. Suffolk, as I mentioned, has 4. So that's our update. This is not what's driving our policies. It is a factor over here. The factors I look at, you've all heard me say many, many times. So we know what to do. Get vaccinated, get the booster, stay home when you're not feeling well, and don't assume you're protected because you've had 1 dose of vaccination. You are not. We need to get everybody to get that second dose and get the vaccine. So that's our report for today. I thank our business leaders and our elected leaders for participating remotely. And at this point, I'll be happy to take some questions.
Thank you very much, Governor. We're going to start off on Zoom this morning. Your first question comes from John Campbell at WNYC. John, your mic is open.
Hi, Governor. 2 questions for you. One, we just saw the state of New Jersey implement a policy where you can have a free COVID test shipped to your home. The city of Rochester did something similar with pickups for free COVID testing. Does New York have any similar plans to implement some sort of at-home COVID testing shipping policy? If not, why not? And then the other question I had is why isn't the state defining fully vaccinated as 2 shots plus the booster if we've seen evidence that the booster shot is necessary to maintain protection against COVID?
Second question first, John. We may get to that point, but I also want to be very rational in our approach and know that there are people, we still have 30% of the population who has to get the first vaccination, first and second doses. I believe that at some point we'll be making a determination that fully boosted constitutes fully vaccinated. But at this time, many people have not had the opportunity to go out and get that booster shot. We encourage them to do that, but I want to make sure that we're not going to make things even more complicated at this time. I believe that is going to change. It's just not today's announcement. And in terms of, yes, we have been talking about targeting zip codes. I have a few more people in the state of New York than some of the other states. I have 20 million New Yorkers. So we've identifying who's not vaccinated as the most vulnerable. We also micro-targeted down by zip code. So we actually have a plan in place. Again, it's being developed. I don't want to get ahead of myself because you'll ask me a lot of questions on the details. But we talked about this several weeks ago, which is one of the reasons why we wanted to amass over 1 million home test kits, which we now have. It took some time to get them, and we ordered them, and they're now in place. So I believe that targeted approach can also help people. There may be people who will never get vaccinated under any circumstance, despite our strong desire, and it's not for us, it's for them and their family members and their loved ones, and all those overworked, exhausted healthcare workers who don't understand why they're still dealing with people who are unvaccinated in the hospitals, still the vast majority. So we want to micro-target and send these literally to people's homes, and we'll get that out there as soon as we can deploy it. But I want to make sure I have all the details before we announce that.
Thank you, Governor. Your next question comes from Marcia Kramer at WCBS TV. Marcia, your mic is open.
Good morning, Governor. I wanted to ask you about your mask mandate, which is receiving, shall we say, mixed reviews. Mayor-elect Eric Adams this morning endorsed it heartily, but the Nassau County Executive Bruce Blakeman just held a press conference to say that when he takes office, he's not going to enforce it. He's not going to make his businesses enforce it. And he says he's upset that you're targeting the whole state with a broad brush when Nassau County is doing so well. What would you like to say to Bruce Blakeman and other executives, county executives in the downstate area like Mark Molinaro and others who are resisting and thinking that they're doing the right thing?
Well, I want to correct you on the front end because you said County Executive Bruce Blakeman.
I'm sorry, he's not.
County Executive of Nassau County does support our initiatives. That is Laura Curran, and she's in office for a few more weeks. As I said, approximately 73% of the New York State population is represented by the leaders who understand that we all take an oath of office. My oath of office requires me to protect the health and well-being of New Yorkers. And when people take their oath of office on January 1st, that I hope that they will follow suit and understand that that's a responsibility we have. It is not always the easiest path. And we are not doing this to win any popularity contests. Every decision we make has pros and cons in the public debate. But I'm not going to engage in a political discussion about this because this is just too important. This is about getting us through this pandemic so we can finally say to everybody, you no longer have to wear a mask, period. That vaccines will be so routine for everyone that you won't think twice about it, just like every other vaccination that has saved lives since they were invented decades and decades ago. We have to get to a point of rational discussion about this. And it's not about scoring political points or getting headlines to call out the governor on an issue. That doesn't affect a single thing I do. I will always do what's right for the people of the state, and right now, we are still in a pandemic. Cases are escalating, hospitalizations are escalating, and the number of people vaccinated is not where it should be. And I would not be overconfident in any county about their current state of affairs with respect to this situation, because we just don't know what the future will bring. This is a preemptive, very unintrusive approach compared to shutting down schools and churches and synagogues and places of work like we saw before. I will not go to that space, and I'm doing everything I can to protect people while we're still in a pandemic. And every other elected or incoming elected official can make their own determination, and they'll have accountability their next time around as well. Any more?
Governor, your final Zoom question this afternoon comes from Jimmy Vielkind of the Wall Street Journal. Jimmy, your mic is open.
Good morning, Governor. Two questions. Is it your hope that businesses will look at this sort of vax or mask mandate and choose vaccination? And also, as we see federal courts strike down some mandates on the national level for large employers, do you foresee making further mandates on businesses for vaccination requirements to fill that void?
Certainly, it is my hope that everyone will get vaccinated in the state of New York. I still have 30% of New Yorkers who are not vaccinated. So yes, it is my sincere hope that businesses will realize that they have an important role, that if they have a vaccination requirement, as we've seen work well in New York City. This was a very large laboratory on this concept of whether people will still go out. Will they still go to concert venues? Will they still go to restaurants? Will they still go to Broadway? And the answer is a resounding yes. People have been doing the right thing here in the largest population, the epicenter of the pandemic. And that's the lesson I want people to see around the state, that here we're actually giving people around the state even more flexibility, understanding the pressures that exist outside the 5 boroughs, and saying vaccination or mask mandate. That's an option that they may not have thought we'd give them, but I'm trying to be accommodating to their interest to keep their customers coming in, but at the same time protecting their health. And with respect to court decisions around the country, I'm not expecting to have any more of a heavy-handed approach, Jimmy, if people get vaccinated and the numbers start trending downward. I hope to be able to say, this is what we need to do. I believe it'll work. People follow this, and I'm calling on elected leaders and businesses to say, I've given us a time frame. Get us through this holiday surge time, our time of most vulnerability. We know this. This is common sense. Do this so the people you love will still be there to celebrate the holidays with you next year. That's what this is about. And also, not just the human, protecting human life. It's also about protecting the lives of our downtowns, the life of our little businesses that are hurting already. I want them to stay open. They want to be. You heard from our business partners, our friends. They're doing the best they can. Let's support them. Put on a mask and go into those restaurants. Show them that you don't want the charm and uniqueness of our little downtowns in particular to be changed forever because a business went out, because you refused to support them, because you refused to put on a mask to walk in the door. We can all do this, New Yorkers. This is not that hard to do, and I have a lot of confidence in all of you that will do this. And I want to be the first to declare that this pandemic is over. We got through it because New Yorkers did the right thing. In person.
Governor Hochul, two questions. One related to COVID, one not. When you announced this mask/vax mandate, my understanding was that there was a lot of thought went into it to make sure that all the details were ironed out, that it was, not confusing and people were aware of it. But on the very same day, there was confusion about how it interacted with the New York City mask mandate, and it almost immediately needed to be updated so that in New York City people could enter establishments with one dose up until December 27th. How did that happen if, this was such a well thought out policy that kind of obvious discrepancy was able to make it into the original version? And secondly, with Assemblymember Dick Gottfried retiring, I wanted to know, as presumably conversations about his New York Health Act will continue next session, I wanted to know where you personally fell in the conversation about single-payer health care, whether you are for it, against it, and whether you will personally petition President Biden to provide the necessary waivers to make it a reality in New York.
Those of you who are just getting to know me will know that there is no scenario where I'm going to start negotiating or having conversations with the leadership of the New York State Assembly or the Senate in a setting like this. These are issues that are on an agenda for some individuals. We're going to keep talking about them, and I have a lot on my plate that's going to be executed upon between now and our State of the State, and our State of the State will give a very clear vision of where I'm heading. So there will be a time when all is known, but it's not going to be announced right here because I'm very focused on dealing with this pandemic. And with respect to the premise behind your question is that we didn't roll this out to your satisfaction. I'm not sure what you're trying to get at there.
I'm just kind of curious why there was this confusion discrepancy with the New York City mandate, if this mandate that you rolled out was, very well planned out and thought out.
Well, it was well planned out and thought out in the context that I was waiting for the right metrics to trigger in my mind, the alarm goes off. And that's what all of you have been asking for. And I said there's going to come a time when I look at the confluence of numbers and what happens when we don't make enough of a dent in hospitalizations, that vaccinations are not where I want them to be, and the cases continue to go up. And we're working with a newly constituted health department. I have tremendous confidence in Dr. Mary Bassett, and to the extent that there's any discrepancies in technical language from the first couple of hours, and then we correct them, I think it's a demonstration of our willingness to get it right. And I'm proud of our team that has been working on this.
It does seem like the numbers are very disparate. You have
Sorry, what was the first part?
the numbers are pretty disparate across New York State. In other words, here in New York City, the COVID numbers are much better than they are in, say, Western New York or the Finger Lakes. Did you consider doing it more targeted in terms of a mask mandate? And would you do that perhaps in January when you reconsider, whereas certain regions of the state don't need to comply with it, and regions where it's really troublesome, they do?
According to the CDC, the entire state is a high transmission area. So let's just put that out there. But also, what's behind your question is New York City and the rest of the state. Well, this is not, there's very little difference between what we're doing and what New York City has already done. In fact, New York City doesn't offer the mask option. So if New York City had not taken their own steps, then we would have absolutely had that surgical approach, and I would have looked at the numbers and seeing bed capacity, which is pretty good here in New York City, watching that closely. Infections were not high, so yes, but it didn't make a difference because they already had a more restrictive requirement in place. So at that point, it just made sense. I looked at every single county, and I saw the trends. I didn't see a single county where the numbers were heading downward in a good direction. I didn't see an area where I saw the hospitalizations having 30%, 40% availability anymore, like we saw during the pandemic a year ago. So that's an interesting question. My nature is to do it surgical, but New York City was already following more restrictive practices. I wanted to make sure that I offered flexibility. Flexibility. The result is still good. I want everybody vaccinated. But for those who choose not to, I wish they would, we're just simply saying a mask. But when it comes to other policies, I do plan to make it more surgical based on what's going on there.
Providing funding for counties to enforce the mandate, how are they supposed to take, what's the incentive to take it seriously other than, a trust system? How would counties take it seriously? I'd also like to know, authorities, in counties. I'd also like to know which medical experts you consulted with, and do they endorse your decision to provide the mandate?
Yes, they do. We'll get to the list. Happy to share that with you. It starts with Dr. Fauci on down. We have regular conversations with Washington, as well as I have tremendous confidence in my own health, Commissioner of Health, Dr. Mary Bassett, who also has conversations with all the local health departments around the state. An important ally of ours are the local health departments who are not engaged to the level they should have been the last time. And so, what was the first part of your question?
Enforcing the mandate.
There's not a requirement that the state fund the enforcement. States, counties have always had to enforce public health requirements. That's what they do. And so we're having those conversations. They were given acknowledgement, they're told in advance we were doing this. And as I said, 73% or so of the New York State population is governed by county leaders who say they support what we're doing here. So that is a pretty large number of individuals represented by people doing the right thing. I encourage the counties to do this, but this is also up to individuals. Individuals are asked to follow regulations and in general follow laws. And that is what we're continuing to do here. There's nothing extraordinary about this. It's one more area where we hope and anticipate that there'll be compliance. And again, I commend all the county leaders and the businesses who have stayed with us through this, who are doing the right thing, because they know that this is a temporary measure to get us through the holiday surge, and we'll come out at the end of this and hopefully look back and say we were able to beat this back, or at least keep it from escalating at a scale that we cannot handle. And that's what I'm trying so hard to avoid, because I do want to keep our businesses open, and that is my priority after protecting the health of New Yorkers. So thank you, everybody, for coming out. I appreciate your time today.